Hello, everyone, and thank you for joining the ARCO Fort Bend County Parent Education Support Group meeting on Zoom today. I'm Carrie Axtell, the Advocacy and Youth Programs Director. We meet virtually on the second Thursday of the month throughout the school year, and we like to start with an informative presentation. If you'd like to stick around after to share any of your experiences, please do. We'd love to hear from you. The ARCO Fort Bend County, we're a nonprofit organization that was established in 1968 for people with intellectual and developmental disabilities. And our mission is to ensure opportunities for people with IDD and their families so that they can maximize their quality of life in our community. Today, we do that through disability rights advocacy for and with people with IDD, and we provide information about community services, resources, organize resource fairs and support groups for parents, as well as support groups for our teen and adult siblings. We also hold several social and recreational programs for people who are in their teens, 20s, and into mature adulthood. So we do lots of fun things. We'd love for you to come out and join us. We're also home to the largest Special Olympics delegation here for adults in our region. And we offer 11 different sports with over 130 athletes. So if you'd like to learn more about us, please visit arcofortbend.org and also check out our Instagram or Facebook page. We're pretty active on social media. But if you have any questions, you can also reach out to me here at the ARCO Fort Bend. We'd love to talk to you and chat. So if you have any questions during the presentation, put them in the chat box and I will share them with Leslie, our presenter, at the end. But we do have some exceptional professionals here in the community, and we are so thrilled to be able to take advantage of and learn from their knowledge and expertise. This month, we're pleased to welcome Leslie Morton, an Assistant Attorney General with the Attorney General Medicaid Fraud Control Unit right here in Houston. So Leslie prosecutes cases involving provider Medicaid fraud and abuse, neglect, and exploitation at Medicaid-funded facilities such as group homes, boarding homes, and nursing homes. She previously served as an assistant district attorney with the Fort Bend County District Attorney's Office for 13 years. She graduated from Texas Christian University in 2006 with a double major in criminal justice and psychology, and from South Texas College of Law in 2009. Her son James was diagnosed with autism spectrum disorder at the age of 2, and he's flourished with the help of early intervention programs. So she and her family are ardent advocates for autism awareness. Leslie, thank you for being here and sharing some tips for preventing and identifying Medicaid fraud.
Thank you for having me, Carrie. So thank you. Good morning. So Carrie said it best. I'm a prosecutor. I work for the Attorney General's Office Medicaid Fraud Control Unit. Half of what I do is I prosecute Medicaid fraud, and the other half is abuse, neglect, and exploitation, primarily in group home facilities, skilled nursing homes, and assisted living facilities. I don't have any disclosures, and I'm not getting paid for this presentation. So for the agenda today, we're going to learn what is the Texas Medicaid program, what is Medicaid fraud, what does the Medicaid Fraud Control Unit do, and what is it, and how does Medicaid fraud affect each of you, and what can you do to prevent it? So let's start first with what is the Texas Medicaid program? Well, I know we've always heard about Medicaid, Medicare. What's the difference? So generally speaking, when we're talking about Texas Medicaid, that is going to be a healthcare coverage assistance program for individuals who qualify due to low income and other criteria, whereas Medicare is going to be for those who are 65 and older. As of April 2023, there are approximately 5.9 million Medicaid cases in the state of Texas and 117,000 cases out of Fort Bend County, Texas. Now, when we're looking at Medicaid providers, those are going to be doctors, any kind of doctors, ophthalmologists, group homeowners, podiatrists, you name it. There are 179,607 as of November 2023, last month. It's important to note that HHSC, so the Texas Health and Human Services Commission, is the one who administers this program. So what is the Medicaid provider enrollment requirement? That states that any provider, so basically any doctor, who wants to participate in the state healthcare coverage through Medicaid must enroll in that. And when we talk about Medicaid fraud, the penal code is what's going to guide us on Medicaid fraud. And it's really important to know that when we're looking as a prosecutor and an investigator, there has to be that criminal intent. And so under the code, it is knowingly. It is knowingly making or causing to be made a false statement, knowingly concealing or failing to disclose information that's permitting someone to gain either a benefit or a payment under the Medicaid system. And so there's over 10 ways that you can commit, that a provider can commit Medicaid fraud just on the state side. It's not going to be just bad business practices, right? It has to go beyond that into a criminal mindset where you're really trying to falsify and to fraudulently misrepresent things and conceal documents. So one of the ways when you look at it on number one is a false statement or misrepresentation of a material fact. And one of the things that number one and number two both deal with is that requires a person to receive a benefit or a payment under the Medicaid program that either they weren't authorized to get or that was greater value than the amount that they were authorized to get. And number three is another one where they apply or receive a benefit or payment on behalf of another person and then convert it for a different use. Number six is another different way that we commonly see, and I'm only highlighting a few of the ways that we see Medicaid fraud, but that's where you present a claim for payment for a product or service by a person who's not licensed, right? There's a lot of providers, physical therapists, for instance, where they have to be licensed in order to perform certain services. Well, if they're not licensed, then and they're purporting to do those services, then they should not be getting reimbursed for those claims. Number seven, you're making a claim for a service and either one of three things is happening. The service or product has not been approved by a healthcare practitioner. It was substantially inadequate compared to the generally recognized standards within the particular discipline. Or three, the product has been adulterated, debased, or mislabeled. And that's really going to protect the patient because we don't want patients to be getting substandard treatment, either a product or a service. So that goes to really protect the patient. So how much fraud are we seeing on just the state Medicaid level? Well, for the fiscal year of 2023, the Texas Medicaid program has seen $56 billion. It is estimated that 10% of the Medicaid program is fraud. And these are just estimates. So one of the obvious impacts of the fraud through the Medicaid system is obviously the burden on the taxpayers. So the Medicaid Fraud Control Unit statement is through aggressive criminal investigation and prosecution to create an industry deterrent so that Medicaid recipients, so those who receive Medicaid benefits, can receive medical care in an environment as free as possible from fraud, physical abuse, and criminal neglect. So for our offices, we're located all throughout the state. And these are just the cities where we have what we call our field offices. And these are our direct phone numbers, just so you have that for personal reference. And here's a map. And so I work out at the Houston office. The Houston office covers a lot more than Houston. We just call it the Houston field office. But as you can tell, the blue area is the Houston office, and it covers, just for instance, obviously Harris County, Fort Bend County, Brazoria County, Galveston County, Austin County, Matagorda County, Jefferson County, all sorts of counties, all located within those blue areas. So what does my office do? What does the Medicaid Fraud Control Unit do? So we investigate criminal fraud by Medicaid providers. And again, when we're looking at providers, that means we're looking at doctors, simply put, doctors. And we'll go into kind of the sorts of providers that we often see, but we can call it doctors versus recipients. Recipients are those that are receiving Medicaid. We also investigate physical abuse, financial abuse, and criminal neglect of patients in healthcare facilities within our jurisdiction authority. So that's often the group homes, the assisted living facilities, skilled nursing homes. We assist local and federal authorities to prosecute our cases. We investigate fraud in the administration of the Medicaid program, and we investigate exploitation of patients in healthcare facilities within our jurisdiction authority. So we are often referred cases. So these are a list of a lot of the different agencies that will refer cases to us. One of the big cases, one of the big referral sources that we get are Adult Protective Services. That's one. Boards for practitioners, so the dental board, different provider boards will refer cases to us. Ombudsman will refer cases. And we also work with other investigators. So DEA, Social Security Administration, IRS, HHS, HHSC, and local law enforcement agencies. So when we look at Medicaid providers, remember, they have to be enrolled to be a Medicaid provider. So they have to be enrolled in the Medicaid program. But a lot of times we're seeing doctors, dentists, therapists, psychologists, counselors, individuals who are within ABA services. When you look at the housing and the medical aspect, nursing homes, hospitals, boarding homes, assisted living facilities, that could be caretakers, that could be the owners themselves, that could be even higher up in the corporate liability ladder. So when we talk about who commits Medicaid fraud, all sorts of people, right? The scale is varied. So we have doctors and healthcare providers. We have those that supply durable medical equipment like wheelchairs and diapers. We have the employees of the doctors and suppliers, so the lower level employees. We have the employees of companies that manage the Medicaid billing. And we also have the Medicaid recipients if they are doing something to share their Medicaid information. So when we look at Medicaid fraud, primarily, some of what we see is billing. A lot of it comes down to billing, and the next slide touches on billing. But we see a lot of upcoding and unbundling. So upcoding is billing for a higher level of complexity than provided. Unbundling is billing for multiple codes for a group of procedures that are covered in a single global billing code. Kickbacks, that's another thing that we often see, and that's offering, soliciting, or paying a recipient for recipient referrals for medical services or items. Padding cost reports, it may be making costs appear more larger than they actually are. Employees enrolling as fictitious providers and then filing false claims and pocketing the payments. Program eligibility, billing for an ineligible beneficiary or recipient. And then drug diversion. We'll often see drug diversion at skilled nursing facilities where, particularly for controlled substances, where the employees are stealing or diverting the drugs and either selling those or using it for personal use. And so that, even though that isn't considered Medicaid fraud, it's still within what we handle within our purview. So for billing, one of the things we often see is services not rendered, unnecessary services, services performed by unqualified staff, services provided by other providers, unnecessary products. So that would be the durable medical equipment, and products that were never delivered, yet you're billed for it. And then I just want to touch on abuse and neglect, since we do handle that. A lot of times we may get a call or referral from Adult Protective Services, and it may start out as an abuse or neglect case, but then takes us into an exploitation or a fraud investigation. So they sometimes do go hand in hand, unfortunately. And like I mentioned, we'll look at the individual abuse or neglect at the caretaker or the group home owner, but also we have the authority to look higher than that if it's a systematic problem within the industry. We also look at financial abuse and exploitation. And so we've seen theft from patient trust fund accounts, and we've also unfortunately seen identity theft. So what is identity theft? Identity theft, generally speaking, is when someone takes your name and personal identifying information and uses it without your permission. A personal identifying information would be your Medicaid number, your social security number, your name, your date of birth, your address, your credit card information, your financial bank account information, anything like that. And so they could open up a credit account, they could pay their bills, they could impersonate you, all sorts of things. And we've seen this done by current providers for the individual, by former providers that actually still had that patient's information in hand, either had the actual card in their possession or just had the card number and the identifying information just documented in their file, so they still had access to it. So how does Medicaid fraud affect you? Well, it costs the taxpayers billions of dollars, and it diverts funds that could otherwise be used for legitimate health care. But additionally, it also increases the risk and potential harm to people who are exposed to either unnecessary services and procedures or aren't getting the help they need. So what can you do to prevent Medicaid fraud and also identity theft? Because a lot of times those may overlap. And these tips go really for anyone and also for Medicare recipients. Don't share your Medicaid number. Don't share your Medicaid card with anyone other than someone you trust. If it's a guardian, if it's a relative, or your social security number, your card. Treat it like a credit card number, credit card information. Don't give it out freely. And it's important with all these tips to be vigilant, right? We're not here to say that every provider is unscrupulous, that every provider defrauds. That's not the message. But the message is you need to be proactive, because unfortunately there are those providers out there that will take advantage of people that they think are more vulnerable or are not paying attention to their explanation of benefits and things like that, and that they can just take advantage of. Next, do not give your Medicaid number to a stranger. Makes sense, but sometimes you just may do it, may not think it's a bad idea. They may entice you with something. They may give you money, gifts, a special offer. You may be solicited by a company. They may try to sell you something. Don't do it. Never let someone use your Medicaid card, and do not use someone else's Medicaid card. Medicaid does not pay for certain things flat out. So it does not pay for mentoring. It does not pay for after-school programs. It does not pay for summer camps and tutoring. So we've had cases where individuals, children are getting just like a tutoring session at some houses, at their houses, and it's just too good to be true, right? It's almost like a babysitter. That's not Medicaid. That's not what Medicaid does. And if it sounds too good to be true, look into it, because Medicaid does not pay for mentoring. It does not pay for after-school programs, does not pay for summer camps and tutoring. And if people are walking door to door, which sometimes they will, and they're soliciting for you to join whatever it is that they're wanting you to participate in, and you have a gut feeling that this is just too good to be true, call Medicaid and you can just confirm, hey, am I eligible for this? Is this legitimate? And if it is, then great. And if it's not, then you prevented. It's all about being proactive. Ask for a written description of the services that are offered to you. Do not agree to services that you think you or your child do not need. Do not sign a blank form. And a lot of this is common sense, but it's always a good reminder just to have this repetitive information. Write down the names of people that provide your services, the agencies they work for, and the dates that the services are provided. What you remember at that time is going to be better than what you remember down the line. And especially if it later is determined to be fraud, your memory at that point, maybe a year later, a few years later, about the exact date, exactly who did what did they do, is not going to be as sharp. That's just human nature. Review your explanation of benefits, review it thoroughly, and review it upon receipt. So I know we get those all the time in the mail, and it's just tempting to put it in a stack and not look at it right when we get it, or not look at it at all. But what if something is being upcoded? What if there is something being unbundled? You may think that that doesn't matter at that time, but it could. What if you're being billed for some equipment that you're not actually receiving? That would be one way that you could identify that at that time. And I'll give you an example. The Medicaid rules are very specific to each and every product or service. So not everything is the same throughout. But one product, and it's electric wheelchairs, you can only get one every 5 years with a claim. So if you are being billed for an electric wheelchair and you don't receive it, you don't know that you've actually been billed for it. But then within that 5 years, you actually need one. What happens? You already received it, but you never really did, but you purportedly did. And now do you have to pay out of pocket? I mean, you have to go through extra steps. So it's a hassle, but it's worth it to read your explanation of benefits thoroughly and upon receipt. So what are the consequences of sharing your Medicaid information? Well, your medical records could be wrong, right? You could have to pay back money if you don't know that you've been fraudulently schemed, or be fined, and you could lose your Medicaid benefits. So it's really important to try to be knowledgeable about what's going on. So I want to give you some case examples of what I've seen. I've seen life insurance policies that have been taken out by providers without the recipient's knowledge and without the guardian's knowledge. And you think, how is that possible? It happens. It happens. And when do you find out? You don't find out until potentially, unless the authorities find out, which thankfully we did in that case. But otherwise, you don't find out until the life insurance policy actually comes into effect. And that one, it was a current provider and a former provider to some of the patients. So, things that shock the conscience do happen. Again, not saying every provider does that stuff, but try to be proactive as possible. If you're not with a provider anymore and they have your Social Security card If they had it at any point, if they had your Medicaid card, get it back so they don't have that in their possession. I've seen some of the providers become a POA, a power of attorney, and make decisions that are not always in the best interest of the recipient's interests. So be careful with that. I've also seen providers change healthcare insurance for their recipients that are living at their group homes without the recipient's or the guardian's knowledge. You know, a lot of things happen. And you know, the main thing is that y'all are here, you're watching this, you're invested. That's what's important. I've seen providers that are the Social Security representative payee take that money that's not supposed to be used for their personal benefit, to pay their personal expenses, but they do, right? That money is supposed to be used for the benefit of that recipient, that Medicaid recipient, or that person receiving that SSI. And they use that money instead for their own bills or their own gambling, their own travel. So always be in tune with that. On the billing side, I've seen it where the provider has an individual's information and bills for services not rendered. So the Medicaid recipient is actually not going and not receiving those services, but somehow that recipient never ever was a patient of the provider. So they have no connection to one another, but we don't know how the provider got the patient's information to begin billing for them in the first place. That happens. Can't explain it, but it does. So now we know about Medicaid fraud, what it is, how it affects you. How do I report it? Well, if you believe Medicaid fraud is occurring, please report it immediately so it can be properly investigated, because that's important. Because the reality is, if the provider is doing this to one individual, they're probably doing it to more than one individual. And it's not for you to make that determination if it truly is Medicaid fraud. It's for the authorities to investigate it and determine if it is Medicaid fraud. So never feel like it is your burden to decide whether or not it is Medicaid fraud. It's just like whenever you make a report to a police officer, it's for them to investigate it. You're just getting the ball rolling. You're welcome when you make a report to remain anonymous. Some people choose to do that. However, it's always more helpful if you have as much information as possible. And, you know, if you want to put your contact information, that way the investigator may want to contact you if they need additional information. Helpful information to include in a report: the name of the Medicaid members. So the recipients, name of the Medicaid providers. I mean, it could be all the way from the top, you know, the owner of the facility to who is actually conducting the service, to the biller, any lower level employees, whoever you know. And if you don't know, that's okay too. The date of the service or services, the location. That way it kind of lets us know, is this Harris County? Is this Fort Bend County? Is this, you know, Dallas County? Location of the services, description of the acts you suspect that involve Medicaid fraud. So just a general summary of why you think something suspicious is going on. And you don't have to be an investigator or an attorney to summarize it. It's just what caught your attention, what made you suspect that something's not right. And so for you just to put a summary in there, if you have any photos, if you have any emails, correspondence, you can always include that. That helps too. Any documentation, things like that are helpful as well. And then there's two ways that you can report it. You can report it to the HHSC Ombudsman, and there's the phone number. and then also to our office. And then there is our phone and our fax number, as well as our address. And remember, this is for the Houston field office, and we cover a wide range of the surrounding counties. And that is my presentation, but I am open for questions if anyone has any.
Thank you, Leslie. That's just shocking. It really, I'm just hearing about all the things. I had no idea that so many of those aspects, like you were mentioning, about providers opening up life insurance in, another person's name, and then becoming POA. So I'm sure, having power of attorney, that's, I guess, not so surprising, but then it's that abuse of that power that has been given to them. And so
what they
really
do with it, what they do with it outside the scope of the power of attorney.
Right.
Mm-hmm.
So like in that instance of the life insurance case, it is, I mean, how would you know? Let's say, I have a older brother who happens to be in, in care of at a home and has a provider, and I'm the guardian. I have guardianship over my brother, but I'll go and visit, but how would I know that his Medicaid number? Because I'm thinking I would probably have to give his Medicaid number to the people there at the group home so that they can take him to his doctor's appointments and do all those things. So how would we kind of maybe monitor? Or
that's a tough question, right?
Yeah.
In that particular case with life insurance, there really isn't a way to check to see if a life insurance policy has been taken out on your loved one, right? There's no database. So, it's not like you can see if someone's taken a guardianship out without your permission, without your consent. So for some of the individuals, because there were many life insurance policies taken out, so it wasn't just one, it was a whole scheme. So
they were being greedy, right? Yeah.
Yes. Oh, yeah. Very much. Seize the opportunity. So, but with some of the victims, I will say, that were contacted, mainly the guardians, who of course had no knowledge of it, there were things that led up to it before, where their loved ones were no longer at the group home, but that there had been prior bad acts committed by the group home, whereas the health insurance had been changed without their consent. So that could have been reported. I don't know if that would have gone anywhere, but looking at the life insurance aspect, there would have been nowhere, unfortunately, to look to see if that had been done. And the sad reality, like a lot of individuals at the group homes that I see, a lot of times they don't have that support. Either the family lives elsewhere, or they don't have close family, and they really do rely on the group home, either owners, caretakers, house managers, to provide for them. That's why they're there, and so they're at their mercy.
Are there any other, like, if you think your Medicaid number has been compromised, either, I'm a parent and I have a young child and going to, from the doctor, pediatrician, speech therapist, ABA therapist, and I don't know, but maybe somewhere along the line, I'm kind of feeling like maybe my child's Medicaid number has been compromised. Is there anything that we can do? Because isn't the Medicaid number, so it's not like we can request a new one, right? So just, I don't know.
Well, so you can report that, and you can, I would say just provide a summary. And if you don't know why, if just, obviously you have a somewhat of a reason, because you're saying, well, I think it's been compromised, but we can pull, even the auditors at our office, who are amazing, we pull claims data. And so we can always see what claims are being filed and for what Medicaid recipient. So that's how we can cross-reference it with what provider, what date, what the billing service code is. So there are ways to verify that. But the problem is, if you don't report even a suspicious feeling, then we're never going to know about it until maybe something else happens or not.
Gotcha. So like you were saying earlier, just paying attention to those explanation of benefits
Mhm.
that you get really is key to helping you
Mhm.
maybe confirm your suspicion of, you know what, my child only went to speech therapy, 4 times this month. Why is it saying here that he went 8 times or
Right.
something like that, right?
Exactly.
Okay. All right. Very good. And then you provided again that, so it sounds like either from contacting you all from the field office, reporting to maybe the ombudsman, or, just those different contacts, is really the way to go if you suspect
Yes.
anything.
Yes.
Another thing I was thinking of in the case of maybe, either a credit card number or something that's maybe been shared with the provider or something, so at least that, if you feel like that payment method has been shared and you think that might be being misused, maybe if you're changing to a different provider, that you can ask for a totally new credit card number or
Mhm.
something, like if you think your payment method has been
Right.
compromised.
Right.
um so maybe that's a good tip to keep in mind for payment methods anyways,
Right. Definitely. Definitely.
outside of your Medicaid benefit itself.
Mhm.
But another thing that kind of occurred to me, because I know several of our in special education will have where school districts will ask if a person does receive Medicaid, that child,
Mhm.
that that the school district be allowed to bill for, like, say, evaluative services or related services like speech therapy,
Mhm.
occupational therapy provided through the school district. Do
Mhm.
you have any experience with that as far as like school districts kind of
I
maybe
don't.
using or misusing? Okay, that's good to know.
Yeah, I haven't seen any of that. Not to say it
Okay,
doesn't happen, but I haven't seen any.
good. That's encouraging, because that is sometimes one of the questions I'll get to is like, why is the school asking for my child's Medicaid number?
Mhm.
And so,
Right.
yeah, just because Medicaid, you don't think about it until like, wow, it really can be used for so many, in so many different
Yes.
areas and avenues.
Yes.
So, all right. Well, Leslie, thank you so much for this information. It's a little scary, but at the same time, better to know.
It's good to be aware. It's good to be
Yes.
aware. And again, not saying every provider is unscrupulous and committing fraud, but keep your eyes open and just be proactive. And we're here to help.
Well, thank you again for that. And I will share this information with those who registered today but weren't able to attend. So thank you for sharing your PowerPoint with us, and we'll get this out to our registrants for today. But thank you again for your time today.
You're
Appreciate the
welcome.
presentation.
Thank you.
Thank you.
Okay, bye.